My name is Zara Todd. I am a disability rights activist and a human rights educator. The idea of a health reset excites me because I believe that the health system is the most important system. Your health and well-being dictates your entire life course, what you can achieve, how you interact with the world, and how you are part of your community. For me, it is absolutely essential that a health system works with the individual and for the individual rather than for the system. It is essential that it takes a holistic approach to how we consider health, that sees health not just embodied by an individual within the flesh that they live in, but an individual within the community that they live in, within the society that they live in, where health looks at how someone wants to live and enables someone to live and die well, with choice and control over their life, where they experience minimal pain and discomfort, where they understand what is happening to them and why things are happening to them, where they are empowered to know and understand and listen to their bodies in a wider context. We know that health is as much dictated by the oppression and inequality you face as the body that you're born in. Air quality, the environment, poverty, wealth, where you live, who you live with, where in the world you are, all of these things dictate at the moment your life expectancy and the quality of life that you live with regards to healthcare. We should have a system that takes a look at how to make communities healthy. So how we can make sure that people can make healthier choices by ensuring that they have access to the information that they need to understand good, healthy decision making for them. That they feel valued as a whole person, not a problematic body part. Nobody has a perfect body. If they did, plastic surgery wouldn't exist. Models wouldn't be at the top of society, and athletics and sporting activity would be something that everybody took part in as an equal. There wouldn't be a need for things like the Olympics or even any kind of sporting event, because we would all just kind of draw. The reality is that that's not going to happen. We do not come out perfect, and that's okay. We need to acknowledge that perfection and normal do not exist when it comes to human bodies. Normal is diversity, normal is difference, and that's what makes life interesting. So when we're looking at health, we should be trying to work with who we have, not trying to make people better, but to make living better. We should be framing the cost of health not around the cost of a system, but the cost to an individual when health systems fail. We should be looking at how we can empower medical professionals to work in collaboration with patients, how we can enable people to take ownership of their own lives and their own healthcare in a way that values healthcare professionals as allies and supporters, and that doesn't exploit healthcare professionals. We need to look at the costs beyond health to society and to communities, so that we're planning and building health systems that support well-being not only of individuals but of communities. No single person is indispensable. Any ill health doesn't just affect I think I used the wrong word. No single person is dispensable, sorry. Any ill health doesn't just affect the person, it affects their community, their family, whoever that might be in a chosen sense. So we need to think about what having good health means for everyone. At the moment, our health system is designed to be interacted with when things aren't going well, or at the points of life and death. We should have a health system that accompanies us when things are going well, when things are not going well, that is just there for us to access should we need to and when we need to. Health is the one thing that isn't guaranteed to anyone. Health and ill health is part of what being human is. Vulnerability is something that we have discussed and that has been in the media a lot during the pandemic. Coming out of the pandemic, we need to consider, what does it mean to be vulnerable? Who is deciding whether you're vulnerable or not? Is vulnerable inherently a negative thing? Vulnerability is something that we should celebrate. Vulnerability and being open and being connected to the world is what makes us human. We are not robots. But in the pandemic, we have seen vulnerability being used as a justification, as a kind of acceptable collateral damage. At the start of the pandemic, we kept being told that it was only those with underlying health conditions or who were clinically vulnerable that was dying. We know that that isn't the case, that this pandemic has affected everyone, but disproportionately affected those who are most discriminated against. Just because those who have experienced the worst of the pandemic first are the vulnerable ones, doesn't mean that their lives were any less valuable. And I think we should talk about people being valuable rather than people being vulnerable, so that we can acknowledge the positive contribution that every single human being on this planet makes to their community, that we are not deficit, that by being vulnerable, it doesn't mean that it's acceptable for us to die. We should have a health system that is focused on those at the margins, those who experience inequality at the sharp end. Because if a system works for those, then a system will work for everyone. one of the things that we've seen is that mental health should have parity with physical health. Mental health is not something to be taken for granted. It's also something that we shouldn't be kind of expecting rainbows and happiness all the time. We spend a lot of time trying to fix people to be perfect, and actually perfection isn't achievable. It isn't even probably desirable, as I mentioned earlier. But we should create a health system that is not putting pressure on people to conform to ideas of perfection. Um, I envisage a health system that acknowledges our limitations of our bodies and supports us to maximize what we can do with what we've got, so that we have the lives that we want to live, and that we're able to contribute to our communities and societies in a way that works for us. I would like to see a health system where those who have most need of the system have the most control over how the system works for them, where we're not waiting on timelines because there is a system or process that dictates that things must happen on there, but we're waiting on what works best for an individual. If somebody wants to make sure that they're available to engage with their grandson's or granddaughter's 5th birthday, we should have a health system that allows people to be human. We should have a health system that allows people to live and not just keep them alive. Thank you. I hope I've given you some food for thought.